I am Dr. Narasimhan, Senior Consultant Pulmonologist with Appollo Hospitals, Chennai, and Chairman of the Respiratory Research Foundation of India. And I would like to share some of my thoughts on this COVID disease. I must tell you, there has not been a day where the guidelines have not changed in COVID. A lot of guidelines changes have been occurring in the management of COVID. We had the first wave, we had the second wave, and now there is a fear that a third wave is going to hit our country, and we are going to suffer the way we suffered in February. In my short talk of 10 minutes, I would like to share to you about whether this third wave is going to be real. One. Number two is whether it is going to affect the children. Two. Number three, what should the children should do with regards to their education? Because most of the children, especially in the pre-KG, LKG, first standard, they are all stay put at home without any exposure and without any exposure to a teacher, the respect, the prayers, and all those things are all missing. And children are knowing ways and means to bunk the classes and other things. So these 3 points I would like to stress. The first and foremost is a third wave. Whether a third wave is going to affect. I must tell you that the second wave has not died yet. It is extinguishing in our country. And I must also tell you that this second wave is predominantly due to the Delta variant and some Delta plus variants. And in US, the place where a lot of COVID cases are increasing are all now the Delta plus and Delta variants, which means we are now experiencing what the US is experiencing in their country now. So we are in the process of the Delta plus and Delta variant, number one. Number two, if you look at the country's national zero prevalence studies, more than 65% of the people have positive antibodies, which they have acquired either because of the disease or because of the vaccination or because of just exposure, which means about 65% are already have fairly good antibodies, which means it is not going to affect the adults the way it has affected in the second wave in the month of February, March, April, where the whole country was plunged into a state of shortage of oxygen, hospital beds, etc., etc., etc. That might not happen. The second reason why I am very optimistic is that our vaccination coverage has picked up quite significantly. The vaccine hesitancy has come down quite a lot in our country. A lot of people are volunteering. Camps are being held in schools. Camps are building in offices. Camps are being held in slums. All these places, camps are being held, and people are overwhelmingly coming for this vaccination. That's a very good sign. And one should observe that in US, where the new COVID cases are occurring or the surges occurring are all in those places where the vaccination was not all that effective. So this is all some of the good signs which makes us become confident that we might not have the third wave as virulently as we had in the second wave. And second and foremost is whether the third wave is going to affect the children only. I wouldn't say that. We are partly right in saying that children are going to be affected because the first wave affected the old people. Majority of the old people with diabetics and other comorbidities were affected. The second wave, when it hit, because it did not have anybody else to affect, the old people were all, majority of the old people were affected, it had to go to the young and adolescent people. It did affect the young and adolescent people, but the mortality rate, I must tell you, was more or less the same only as it was in the first wave. The rate wise, though the absolute numbers were high, but the mortality rate, if you calculate and see the case fatality rate, which you say, was more or less the same as it was in the first wave. If you take the third wave, the COVID when it comes, it has to affect somebody else. The only vulnerable population is going to be children. Whether the children will get such serious and severe disease which the adults have is something that would not occur. I'll tell you the reason why. Because the virus has to cause a severe disease means the cell wall should have an enzyme called an ACE, angiotensin converter enzyme. That enzyme is not all that well matured in kids. So that is the reason why most of these virologists, scientists, clinicians across the world are telling that it might affect the children. Most of the pediatric age group COVIDs would be asymptomatic, but they are capable of spreading the disease. How does it spread? It can spread when one talks, when one sneezes, when one takes a breath, when all these activities which occurs with the nose and mouth, they can spread, though they do not suffer. So there are two things which one should notice. Children will get affected, they might get affected, they might not get a serious disease, which means parents should know that they should not get worried when their child has some sore throat and somebody advises a RT-PCR test, and RT-PCR test turns out to be positive. What all you must do is to put on a mask, maintain the usual universal precautions of social distancing, masking, and hand sanitization. That is more than sufficient. And the parents and the children alike, the teacher and everybody, I would suggest that COVID has come to stay with us. One should learn to cohabit with it. One should not think that COVID would run away one day. Bye bye, I'm just going off today, you all be happy. It is not going to be like that. Most of the diseases which have come as pandemics or epidemics have stayed back, and COVID is one such disease. I am telling this, it is very, very important. The parents should realize, and also the children should realize, that it is time for them to learn to cohabit with it and start going to the school and start learning experience. Children are missing a lot of things in the school. The sharing nature, the fighting nature, the competitive nature, so many things which the children are missing because of absenteeism in the schools due to the COVID is something which is going to have a long effect psychologically in the long run. So it is time for us to wake up. It's a wake-up call for us to know about this third wave, and also to know that the third wave is not going to be very serious, and also to know that even if the third wave affects the children, they will not suffer the way we have suffered in the second wave. There are not going to be any hospital bed shortages and oxygen shortages and so on and so forth. And lastly, and most importantly, I like to stress home the point that everyone should get vaccinated. Even children we are getting the vaccination policy for children too shortly. They also can get vaccinated. But until that time, what's most important, I keep on stressing, is these children could be super spreaders. Many people do studies and say in other countries, Israel, they opened and closed, South Korea, they opened and closed, US, they opened and closed. They are the times when the COVID was at its peak. Now we are seeing a COVID that's on the wane. When the COVID is on the wane, when the vaccination is picking up, when things are brightening up, that's the time for us to expose our children to the school, but with a rider that everyone in the school who are going to teach, who are going to take care of the children, it may be from the watchman to the ayah, to the caretaker, to the teacher, to the headmaster, to the clerk in this, everybody should be vaccinated. They should always, all of them should cover themselves with the vaccination, so that even if the child gets infected, and an infected child by mistake comes to the school and starts spreading, you have a vaccination cover. So which means mask and the vaccination are 100% providers. And between the vaccination and mask, which is the best, means mask. I think with this short talk, I would end my point saying 3 important points I said I would discuss. 1, third wave of COVID, yes, it might come, but the virulence may not be as severe as it was in the second. We can go on with our business. Children, very important, they should take care. Parents should take care and encourage the management to start the schools with all COVID appropriate behaviors. And third, and most importantly, you have the universal precautions, start doing them, and also never hesitate to get vaccinated when your turn comes. Thank you all. Have a nice non-COVID period.